KZI 9 News reporter Jillian Smuckler joins us live tonight with more on that warning and how schools in our area are responding. Jillian?
Matt, Renee, 6 months into this pandemic, Lane County is reporting the worst numbers we've had so far. 175 people are considered infectious, which is an all-time high. We currently have 7 outbreaks in our area, and the University of Oregon reported its highest single-day COVID-19 case count just yesterday. Now, all of this comes as health officials say they're falling behind and that things need to turn around soon.
It is the most significant spike that we've seen to date.
Jason Davis with Lane County Public Health says he's concerned.
We are worried that the spike will result in a continued exponential increase in cases.
So much so that they're bracing for 3 to 4 weeks of an upward trend.
Then we lose a handle on the preventative measures, and we see it spread throughout the county and into populations who could be very adversely affected by COVID.
So they're going back to the basics.
The first and best way is to not have the social gatherings.
Back when we had a relatively low case count, we were able to adjust our gatherings to make them safer. But now, since our cases and contacts are considered high, they want them to stop altogether. Bottom line, even 10 is too many, especially because they say that's what's driving the spread.
And it really enables public health to get a better handle on the cases, and it'll result in us being able to have a downward slope on our cases.
Davis says Lane County is dealing with 7 outbreaks right now, all made up of people ages 17 to 28. But he wanted to make one thing clear.
This is not a University of Oregon problem. We are seeing students from other schools involved in these clusters. We are seeing people who are in this age group who are not students. This is really a behavior problem.
This comes after the U of O saw its highest daily COVID-19 case count Wednesday, 18. But even still, he says if the majority of the community practices good preventative measures, it won't spread as fast.
The behavior problem extends far beyond the people who are actually sick because we're seeing it spread to other age groups as well.
A University of Oregon spokesperson says since Lane County had such low numbers in the past, they anticipated an increase in cases. That's why they proactively put extra strict prevention measures in place for students living on and off campus. Steve Clark with Oregon State University agrees, and he says we need to put as much attention onto our individual actions as we do towards schools.
Our students are like other Oregonians. Some of them have the virus. We know that many people in Corvallis have the virus. Some are asymptomatic, some are not. And that's why testing is so important, but that's also why public and personal health measures are so important.
Now, Jason Davis says we're also seeing new cases pop up at long-term care facilities and workplaces. And he also says he's received multiple reports about people just returning back to work while they're symptomatic and infectious, which is obviously not okay. So he says the moment they meet that threshold of 10 cases at those workplaces, they'll be able to give us more in-depth information about where exactly they are and who is involved with that. And then, of course, the sooner we slow the spread of the virus, the more detailed information we can get about these new cases and new contacts that we've been reporting. Reporting live in Eugene, Jillian Smuckler, KZI 9 News.